Hello, my name is Andrea Gossard, and I'm a nurse practitioner who works with patients who have primary biliary cholangitis. As many of you know, on November 14th of this year, Ocaliva will no longer be available in the United States. We anticipate there will be a transition period of approximately 60 days, during which time Ocaliva or obeticholic acid may remain available for patients as they consider transitioning to another therapy. If you have patients who you have prescribed Ocaliva for in the past, you'll need to work to identify those patients and have the discussions regarding this transition. We know that patients may have a sense of anxiety about having to move away from a therapy that they've thought to be effective, or perhaps they have questions about why this is being pulled from the market. These are conversations that we would encourage you to have. Importantly, if patients ask about transitioning off the therapy and whether or not there needs to be some type of tapered dose, the answer to that is no. You can safely discontinue therapy without any type of taper. There have not been any withdrawal effects identified through clinical trials. Many patients will wonder what else is there that they could consider transitioning to. And as I mentioned, those will be important conversations to have. As we go into the fall and this anticipated date of discontinuation, be mindful not to initiate any patients on obeticholic acid as you're looking at therapies for their primary biliary cholangitis. Some people have wondered, what would we want to do once the therapy is discontinued to sort of monitor their liver tests or their liver status? Likely during therapy, you are monitoring levels of alkaline phosphatase, bilirubin, aminotransferase levels. This would be something to certainly consider repeating after the therapy has been withdrawn, perhaps at 12 weeks and then every 3 to 6 months, as you watch to see what kind of effect of discontinuing therapy may have on their disease. We know some patients will experience potentially a rise in their alkaline phosphatase. So again, being ready with conversations about what might be next is important. Patients may also comment that they have change in clinical symptoms, such as pruritus or fatigue, unlikely to have signs of liver decompensation, but of course, we're always monitoring for that when we care for our patients with primary biliary cholangitis. Closer follow-up may be warranted if the patients have a bit more advanced stage disease as they've been on this treatment and are now discontinuing. So be mindful of that as you manage their care. We don't believe that there's any need for immediate imaging solely due to the discontinuation of obeticholic acid, but obviously maintaining your standard protocol with monitoring with imaging every 6 or 12 months appropriate to the patient's clinical stage is essential. So we thank you for listening to this podcast, and we look forward to working with you in the future. Thank you.